talking about with body awareness are a whole series of things you learn. You learn how to run with your whole body. That is critical to engage, your hips, your core, your shoulders. Make sure you relax your neck, especially. Balancing your head on your body is really important. So yeah, nothing I do every day, Mike. I just gradually add to my skill set. And now, of course, you realize it's my birthday this month. I'll be 83. Oh my God. I always tell people.
Oh wow, happy birthday when it comes.
Yeah, I always tell people I got 1 foot in the grave and 1 foot on a bike pedal. So, so everything's a matter of, it's just like if you're studying a subject at school or you're like becoming an engineer, you gradually add to your skills, which you incorporate into your daily work. So I would say from Feldenkrais and yoga, I learned a whole bunch of stretches that really work for me. So every time I go to the gym, after I work out, I will do my stretch routine. I find I do my stretching better at the gym than I do at home. And you can't do stretching with dogs jumping on top of you and stuff. I mean, it doesn't work. You've got to be in the right environment. And the gym is a perfect place for that. Plus, you can learn from other people in the gym, which is really good. You don't do things every day. You do things according to your personal strategy. And your strategy is really important.
And do you stretch before and after a workout? Or just after?
I never stretch a cold muscle. So before my stretch routine, I used to go on a rowing machine and do a light workout to warm my body up. And then I would stretch. Now I usually have, lots of walks with the dogs and stuff, and I'm pretty well warmed up for the age I am. So never stretch a really cold muscle. And I always stretch after my workout. One of my coaches recommended when I went on runs to run a mile easy and then do a stretch routine and then finish a run, be it 10 miles or 20 or whatever. And so, you have to incorporate stretching into your daily life. If I'm working out a lot and I'm getting a lot of tight muscles, I'll stretch, in the grocery store when I'm waiting in line. I'll stretch in a post office. I just, if I have to go on an air flight, I would do a whole routine, on the plane. It's you kind of build it into your life somehow. It's a matter of skill.
Thank you. Sorry, I'm just getting attacked by a mosquito while I was. It's hanging around me. Sorry.
Oh no, you want to get rid of them down here.
Oh no, here in California, they're going to be releasing, or I heard they were going to be releasing some genetically modified mosquitoes to prevent, to try and stop any sort of mosquito-borne illnesses somehow. So be careful, those mosquitoes out there.
Yeah, here is black flies. The black flies are horrendous.
You must be a sweet guy. Oh, I hate those black flies. Oh my gosh, especially I was out there water skiing in Texas, and that's where I discovered flies bite. Here in California, flies do not bite.
And they're full of blood. I killed one on my leg. It was full of blood. It got me.
They hurt. They really hurt.
I was just out walking the dog. Anyway, that's chapter 2. And it's there's many ways to approach the problem, which then prepares you for number 3. The book is 20 chapters long, so it's this is just the very beginning of getting ready to do your training. And I think this applies to people in wheelchairs, people with amputations, people who are older and never worked out in their life before. I created a 3-month training schedule, which you could convert to a 3-year training schedule. It covers the important bases, like working on balance, strengthening your core, a good shoulder hip counter rotation, low impact running, use of a treadmill to strengthen your hips. It's one thing after another. You gradually add to your repertoire of training. And it's just based on Ironman, which of course, anybody could do, I guess, if they want.
Yeah.
If
can you imagine, Kevin, can you, so
Hi,
there's a Feldenkrais instructor that I somehow got connected to through email and YouTube. I can't remember who turned me on to him, but he's quite he's quite a distance from me, and he does instruct in person, and he even has like a long program of a year or 2 years or whatever it is. It's pricey, but he also does a lot via Zoom, and I'm wondering if you could imagine that Zoom instruction could be as useful as in person. I mean, the question seems ridiculous, but I don't know.
Actually,
I think it's a ridiculous question. It's a
no,
great one.
yeah, for Feldenkrais, actually, I guess 80–90% of it you could get from videos. I mean, there are really good Feldenkrais videos on YouTube. There's all sorts of things. You just build a repertoire of exercises. For instance, I mean, some of the exercises are really weird. I went once a week for 5 years to a Feldenkrais expert, and I learned new things every time. And for instance, my shoulder blades tend to be very tight and glued to my back. They've always been like that. And in order to get them loosened up, she had me go kneel on the floor and put my hand flat on the floor. And then without removing my hand from the floor, move around as far as I could, getting under my arm, getting around here, moving around. And what that does, it kind of pushes your shoulder blade to move as well, because it's attached to your arm. So that was very simple. Another exercise, which was very common, every session she would say these weird things, but there was never an answer. She'd say, well, I'd be lying on the floor, and then she'd say, is your right ear closer to your right knee than your left ear is to your left knee? And you think, well, it's funny you should say that. And I would wonder, and it would always be one was shorter or closer than the other. And so, then you'd look down and see that you couldn't see any difference. Or she say, do you think your feet are both outwardly rotated the same amount? And you wouldn't look, you had to think about it. And you think, well, maybe my left foot's a bit further out. You look down, it's your right foot that's turned further out. And so you're slowly building an awareness of your physical state, which is why I call it proprioceptive intelligence. It's and it's something I even do now. I'll find myself kind of surprised that I misread my body. It's like Mark Twain's famous saying that I used to tell all my scientist students: it's not what you don't know that gets you into trouble, it's what you know for sure that just ain't so. And that's true of body awareness.
Yeah. Thanks.
Yeah. Well, cool. Marina, what do you think? What do you think of his chapter 2 and body awareness as you are getting ready to get started again, with your workout program? You've had a bypass procedure, and you're going to need to do a little check-in with your body before you start walking at full speed ahead, right?
Right, absolutely. I thought it was great. I thought it was very interesting. But yeah, I need to, it made me think maybe I should get a physical therapist or someone just to help me out a couple times, or a trainer at the gym or something, just to make sure, because my leg, it hasn't been used correctly for a long time, my right leg.
Yeah.
And my left leg is still ischemic. So, I have a few challenges there, but I'm ready to go back. And so it was very interesting, Kevin. Thank you.
Yeah, it's amazing. What about you, Douglas? Douglas just got done actually taping a show for Abled and On Air, and he was representing the Global P.A.D. Association with that. He was trying to inspire people to walk. Go ahead and unmute, Douglas. Can you unmute? I wasn't sure if he was joining kind of both at the same time, one on his phone and one on his computer. What did you think of chapter 2 here, and making sure to assess your body and becoming more body aware before you start your walking program?
Well, the first thing I thought about was becoming body aware every day I get up, I seem like I hear a different noise coming out of my body, or different pain, or different ache as I get older, and becoming more and more body aware of how I sit, how I stand, how I walk, how I carry things. We know the important, we hear all that stuff, but when you carry things, carry it the proper way so that your body doing things properly, so that my body hangs in there a little bit longer than it wants to. And being able to be aware of that and know the right way to do things. Because, I'm sure there's a proper way to sit and cross your legs, or how long do
Or
you
don't
sit?
cross your legs.
Yeah, or whatever, so that you do become body aware of how you're treating your body, because that's what I live in. I live in my house, but my body's my number one thing I live in, that I have to take care of daily
Yeah.
and be aware of, so that it lasts as long as I want it to last without creating issues.
Yeah. You don't want to go out on a walk and then suddenly have your ankle give out or something like that. You really have to pay attention, to your
They're
body.
not the shoes, and what he talks about, how you walk, the movement of your walk. How do you walk on sand, dirt, gravel, concrete? Your walking technique, so that you're using your body to its best, I guess, or using your body to its best performance, and being able to be aware of that. It's optimum usage, so that I get the best usage, and I don't strain it or push it or put it in positions that it doesn't want to be in. Because how many of us? I'm turning 65, and I still have days where I think I'm 22, and my body goes, "Wait a minute, Doug, hold on, you're not 22 anymore. Stop what you're doing. You're 65 now. You got to be aware of that."
I have one video which was actually interesting. There's a lady called Geneva at the mall, and I used to go to the mall to write, because I didn't know anyone at the mall, so I wouldn't get interrupted. But there's the white noise, so it felt like a social life, I guess. And sometimes I sit on a bench, and there's this lady Geneva sitting next to me, and it turned out she was 89. I guess I was about 75 or something like that. And I've got a video of this with her doing it on my channel. And this is very much a body awareness thing of using your body optimally, which is a skill. She was having trouble. I noticed when she got up to go, she was having trouble standing, and she would like push on the chair and try and get up. And I said, "Are you having trouble getting up?" She said, "Yes. In fact," she said, "I'm having trouble getting out of bed in the morning. And my daughter is thinking of putting me into assisted living. And I don't want to go into assisted living. I'm independent. I like to get around on my own." And so I said, "Well, let me show you how to get up effortlessly." And she looked at me a little skeptical. And it turned out she had a very large handbag, which I said, "You can use that handbag to help you get up. What you're doing now is you are straining your lower back. You're not using your body optimally." I said, "Now this is what I want you to do." And I filmed her doing it, which is on the video. And I said, "You got to scoot yourself forward till you're on the edge of your seat." I said, "Fine. And remember to keep your feet on the ground flat, because you're going to put your weight on your feet, but you're going to use the big muscles of your hips and your quads to get up with, not the little tiny muscles in your core and in your back." So I said, "Now take your handbag." She took the handbag. I said, "Hold that handbag. Now you're on the edge of your seat. To hold that handbag and put it out in front." And she put it out in front, and you could watch it. It pulled her forward onto her feet. It was effortless. And then I said, "Now stand up." And she stood up straight away with no effort. And she said, "That's amazing." She was all excited. And about a month or two later, I saw her again, and she said she'd applied that to getting out of bed. And her daughter had backed off on the plan to put her in assisted living. And so this is just simply using your balance wisely. It's like that. I have a video on the list called rock balancing, where you have to follow your center of gravity. And one thing you'll notice if you watch brilliant athletes, there's one thing they all have in common. It looks so effortless. They just do it like a gazelle. That's because they are using their body optimally. They've trained themselves over years.
And that's Kevin. I think that's what I love my woodworking. I love my woodworking, but you know, some of it gets heavy, and I've had to learn how to carry things where it doesn't overload me. Because, like I say, when I sometimes I think I'm 22, I'm going to pick up 6 pieces of log and carry them across the yard to work on, and I have to realize I can't do that anymore. So I've learned how to do things now that I used to do when I was 22, but I do them now at the age of 65. I hope that makes sense. So it really is learning what my body and how to do things today where I don't overstress myself.
Right. So if you're picking something up, don't bend your back, bend your knees. Take the load on your quads and your glutes. If you bend over, you could risk straining your back, which is actually pulling on your hip flexors largely, which will cause you to strain your back. But if you bend your knees to go down and pick it up. So yeah, you're right. And you learn it if you listen and notice what you're doing. And if you don't, you don't.
So in terms of body awareness, and you bring up an interesting point, because I'm having surgery on Friday and I'm being told, that I'm not supposed to use my abs for an entire month, which, being a woman going on 51 very soon, it's hard enough to keep your abs in check, right? Without having to, as I work out every day, but then to go a month without it, I'm just having a fibroid out. It's a woman thing. Almost every woman has it. But I'm wondering, they say don't bend over and pick anything up that's over 10 pounds for a month. Can I, because it seems like when you bend down, you're saying like not to bend down, but you can squat, right? You can squat without using your abs and just really focus that energy on your thigh and your glutes, correct?
Yeah. Yeah.
Okay, so I could probably do that instead. It won't affect my abs.
No.
Okay.
If you're aware of that and your core is strong enough, your abs won't really get that involved if you use mainly your glutes your quads to get up. So you go down, but the trick is to go down, but don't look down, because if you look down, you'll turn forward. And so if you have to get stuff off the ground, the 10-pound thing is kind of weird. They always say, all these doctors say 10 pound. They said 10 pound to me, and I'm thinking, you don't lift anything more than 10 pound. When I'm like, well, how's a guy who weighs 250 pounds going to stand up? I mean, I weigh, 150, 160.
Good point.
And so you're picking up more than 10 pounds. So what they're really saying is don't pick up anything heavy, which for different people is different amounts. And but yeah, I guess, you have to be careful and you have to listen, because you're bound to you'll engage your abs whether you like it or not because of habit. And then you just take, I had to be very careful not to open my shoulders wide because I had my chest cut open, right? So I didn't want to strain the incision. It took me a lot of focus. And every now and then I would reach over for something without thinking. I'm like, oh shit, I don't want to rip that incision open on my chest. That could be a bad thing. And so it's like that. Stay aware before you move, think. I think that's about it, really.
Okay.
Hey, Kim,
That's good to know. Yes, Douglas.
here's a book. Look, when I was, if I'm 22, this is what I'm going to do. So imagine that one of my logs. I'm just going to walk over and I'll go like this and manhandle it. That's not what we're talking about, right?
Yeah.
I have to be able to realize, walk up into my knees, because it keeps my center of gravity. Use my quads and my legs and all that to stand up properly.
For those of you on YouTube, Douglas just gave us a good demonstration. Kevin, what do you think? Is that the better way? Is that more of what I should do versus bending over?
That's exactly right. It's a total different use of your body, completely.
Because you know what I want to continue to do even after the surgery, what they're worried about is they don't want me to pop a stitch on the uterus where they take out this fibroid. And so I understand I was at first thinking they were talking about the superficial, the surface level incisions, but they were actually talking about the uterus. And I was like, wow, okay, you can't see what's going on inside. And if it bursts, that's a problem. So I completely get it. But I like to do squats. So as I'm brushing my teeth, I do up on my tippy toes and down, I do 50 of those. And then I do 50 squats when I'm brushing my teeth. I know, crazy. But I
Well,
want to make sure that I can still do the squats and not interrupt whatever's going on with the stitching in the uterus. So not using my abs.
yeah, no, you can see how Doug did it. He was basically doing a squat. And,
Yeah.
You know, so yeah, that's the trick. Think before you move. And if you get pain of any kind, just listen. Yeah, and you don't want to tear a stitch. It's like on my chest, I didn't want to spring a leak with my heart and bleed out. So
How did you probably didn't have as much of an issue, but they told me not to cough and not to laugh. Not to laugh. So I'm not going to talk to our producer Joshua because he makes me laugh. So
the worst is sneezing. I
Yeah.
had a cushion. They gave me this cushion shaped like a heart. And every time I had to cough or clear my throat, or if I felt a sneeze coming on, I would grasp that thing. This is for a whole month. Grasp it to my
Yeah.
chest, tight and hard as I
Yeah.
could. And that really worked. If I didn't do that, I'd have a lot of pain down the incision, and I'd risk, the healing of my sternum. Let me shut my dogs up. Hey guys, can you
we
stop?
can't
My
even hear him.
cushion, my cushion after I had my heart, but
Oh yeah, you
after I
too. You had a myectomy.
yeah, after I had my cushion became food for me. It was my lifesaver because I carried that thing. It went everywhere with me because I didn't want to cough or sneeze or that
Oh no,
cushion. That
sneezing. I forgot about that.
that cushion was my lifesaver, and it was shaped like a heart.
Yeah,
But yeah,
I think I'll probably keep mine for my life. I put it in the truck once I could go out in the truck. And yeah, I took it kind of around with me in the house because you never know when suddenly you need to cough or sneeze. And man, yeah, that really,
Yeah.
because you're talking about splitting open your chest. That's not a good thing.
and how hard was it, Kevin, to talk to your body? Don't sneeze, don't sneeze, don't sneeze, don't cough, don't cough,
But
knowing that.
where the hell's my cushion? Where's the damn thing? I'm trying to prevent myself from coughing or sneezing, and then I'd find it. And if I couldn't find it, I'd grip my chest like this really tight. It wasn't quite as good without the cushion, but yeah, you and I can relate to that, right, Doug?
Yes, sir.
Yeah, they
And
told me
I
I'm gonna
put
have to. They're not gonna give me a cushion, but they told me that I should have it just in case. But other
So
than
in other
that, easy
words,
recovery.
no jokes for a whole month.
No jokes. No one
How
is
we
gonna
go-
send me.
how we-
No one send me funny memes.
How are we supposed to thrive with? How are we supposed to thrive with no jokes and kill for a whole month?
I am the joke. You guys can all laugh. I'll let you all laugh.
We could grab.
Just don't make me laugh.
You could grab your cushion, but I'm not sure how well that will work. I'm trying to think of the best way to protect your abdomen.
Yeah, that's what I'm really most concerned about. The good news is that they want me to walk. They said I can pretty much walk immediately. I have my treadmill, which is great. So they want me up walking every hour. And I thought it was just interesting because, when you don't feel good, and this is why, Carl, before the show, you were talking about if you're tired, you don't feel like it, you're not feeling as good as you did before. It's really hard to get up and do what you probably should do. And it almost seems counterintuitive because you don't want to, if you're aware of your body, right? Body awareness, you don't feel like moving. But you got to move. You kind of move it or lose it. You move it or you're going to get stiff. And they worry about us getting stiff by just laying there in bed. So the better healing, they claim, is just getting up and moving. But inspire us with the words that you shared prior to the show so others can hear it, because you really inspired me.
Oh, wow, thank you. So I'll just start like by picking where you just left off, which is what that made me think of was it reminded me that I had been thinking of this, which is that the collaterals, while they, will grow and respond to appropriate level of demand from the claudication and the walking, that they don't persist well. And so I've heard it said here by some of the doctors and you, and I think Kevin even, and others, that when you can get benefit, you will get benefit. But if you wind up bedridden, or for whatever reason you stop walking for a period of time, that these collaterals will atrophy. I'll just use the word atrophy. Maybe there's a better word. And so that was really, that's one thing that really hangs for me in my awareness, is that it's got to be maintained, if not improved, but at least maintained. And so I pushed really hard. For some reason, the last month was maybe something like what Douglas was talking about, kind of the 16-year-old mind, pushed in a bunch of different ways. And so I kind of pushed and went along with it. And, and I injured my feet. And I just decided to like up my walking. Kevin often says, like 5 to 10% is the rule, 5% at our age for increasing your stress and strain over time. And, and so like I upped it like 85% one day. And my body responded. And so I just kind of wound up doing that in a bunch of different ways. And I wound up having a shingles outbreak. It's just kind of like I stressed myself in every way that I could. And so fortunately, it's not an insane. It's not like it's not like so insane that all I can do is see the red pain. But it's still happening, and I had a fever, and totally drained my energy. I barely ever nap, probably not because I don't need it, but because I just resist it. And like all of a sudden I couldn't resist it. I thought, well, I'll set an alarm and I'll take a 40-minute nap. And I woke up 2 hours later. I slept right through the alarm. And so I was like, okay, whoa, my body is really telling me something here. I really need to respond to. But at the same time, as kind of everything fell apart and I just didn't have energy, it just really rang loud in my ears that I need to keep my collaterals maintained. If I can't improve them, I've got to maintain them. And so I like kind of made a really conscious decision that I was going to eat and get my walk in. And if everything else fell apart, which it did, it's like my books piled up and my clothes piled up and the dishes piled up. It's like I got to do the walking, because I was more afraid, more concerned about going backwards on my walking than I was about kind of just losing pace on everything else in my life. And so I followed through with that. And it's interesting because it in a certain way it kind of mitigated the pain of the shingles a little bit, because I have a tendency throughout my life. I grew up in a family of people that catastrophized when shit went wrong, or and it's like I have a tendency to criticize myself or whatever, and to feel like, oh, I don't have energy, I can't go swimming, oh, I can't go buy the food I need, the right food I really want to have, and kind of get depressed because of that. And this time I didn't do that. And it's an interesting thing, because I think discovering that, first discovering that PAD was the predominant pain in my leg and my body, and that there's something to do about it, and that the body has a way of responding to it by working through the pain. I think that really gave me a perspective on how to keep myself not catastrophizing. Like, the pain of shingles is horrible. And it's like, if you give into it, you feel like your skin's being peeled. And like every move you make, it just hurts. It fires off. And
Yeah.
and I'm finding that I'm having definitely less of an emotional response to this all. And almost like, the pain's definitely there. It's like I'm having nerve pain. All the nerves in my body are like hypersensitized right now. And some of them, like, I touch something and it's like, whoa, like an electric shock. And it's like, that's not my normal state. So it's still just not bothering me. It's the best word. It's just not bothering me. It hasn't got me by the neck, and it's not throwing me around and preventing me from feeling like I still have a life. And so, in a funny way, I have to thank discovering my P.A.D in claudication and the usefulness of experiencing that pain with, like, being in this different state. I really am grateful for it. It's just that the shingles came along and it slowed me down.
Yeah. Well, thank you so much, Carl, because it's inspiring to all of us, because we all have a reason why we can't walk, why we can't move our bodies in some way. I just had a conversation, Kevin, with a patient out of South Carolina. Actually, Douglas is on text with him too. He's the sweetest guy. Ended up with an amputation. The doctor barely even tried to open up anything, especially below the knee, and just cut off the leg. And then he was going to cut off the other one for an above the knee problem that only required a wire and balloon and 20 minutes to open it up. And it's crazy. So he's really struggling. It's been what, 3 years, and he's having problems again. So he's got to get revascularized. But he's sitting at home. He's like, what can I do till then? And I said, I have the perfect solution, the P.A.D 100. And go to Fit Old Dog, youtube.com/the outside Fit Old Dog, and learn how to do the P.A.D 100. Everyone, if you at least have 1 foot, do it with the 1 foot. Even in your mind, even if you have bilateral amputations, do these P.I.D 100s with your mind. You have that phantom pain, right? At times your toes, your mind can sometimes think the toes are there. If you think you're moving your toes with the P.A.D 100, moving those ankles, then the rest of your thighs are going to move. You still need to figure out how to move your body. You need to move those stumps. I know it's hard. I know it sucks, but you've got to move. And back to what Kevin was talking about, that's all about starting with the body awareness. What is going on with your body? Get that PT to talk to you about what you can do. Of course, your limitations, but what can you do? How can you move and get the exercise that you need to build those collateral vessels in your legs, even your stumps, and also build the collateral vessels around your heart? Kevin, you also inspired another extreme athlete who's going on 70. He ended up with a problem with his Achilles tendon, I think it was. And when he injured it, he ended up with a blood clot, and it went up into his heart. And because he had grown so many collateral vessels around his heart, is what they said, that it's why he continued to go for several days and did not drop dead right then. And he was able to finally go, I think something's wrong here. I went to the hospital, and the doctor's like, how in the world you had a blood clot in one of your main arteries? And they looked, and it was because of the collateral vessels that he had built around his heart, which is amazing. But now he's having some cramps in one of his in the leg that he had injured, and feeling like his foot is colder. And they're thinking, okay, well, maybe it's nutrients, maybe electrolytes, maybe something like that. And I said, go watch this video with Kevin. And they came back and they're like, oh my gosh, we need to make sure to get an additional vascular assessment, because he might have grown tons of collateral vessels in his legs as well, but he might have some artery blockages in those legs. It doesn't mean he needs a procedure, but it's worth knowing, right, Kevin, that
Yep.
you have something there and that you can keep watch on it. But it's those collateral vessels, knowing your body, but paying attention to it and acting on it, right?
Yep, and having a correct diagnosis is critical. If you don't
Yeah.
have that, you don't know what you're treating. I found when I was having my, my cabbage heart surgery, when I was stuck in there for 2 weeks in the hospital, tied down with wires on my chest and all that stuff. But doing that P.A.D exercise, the 100, I'm sure it made a huge difference. I would do it like every hour or so during the day. Sometimes I only do 10 or 15. Sometimes I do 100. But I keep those toes moving, keep blood flowing through my feet, which kept the collaterals open, because that's, where the blood is coming from, most of it now. Yeah, I found that help. Or if you can find any other exercise that works for you, if you find something better, then please tell us, because we need all the help we can get.
Yeah. But those ones that really works. And I told the other patient about the P.A.D 100, and we try to promote it as much as we can. Even Douglas does the P.A.D 100. Right, Douglas?
Yeah, and I think this comes down to one thing. It's very simple. The doctor does their job. You take your medicine, it does its job. You eat right. The food helps take care, and it does its job. If you stop smoking, that does its job. But I have to remember, none of that works if I don't do my job. I have to become my best advocate. Absolutely 100%. We talk about that all the time. I have to do my part, and I can't do that sitting on the couch. I have to get up every day and do my part, so all of that works together.
Well, on that note, it's fantastic way to end this segment. Kevin, absolutely wonderful. Make sure that you pick up his book if you can, on Amazon. Just look up Kevin Thomas Morgan and you'll see the PAD training manual on there. Because I think possibly next week, Kevin, we're going to tackle chapter 3. And we're going to go through that as well. It's really fun to be a part of the live studio audience, though. Info at padhelp.org if you want to participate and do a live reading with us, or else make sure you do subscribe to our channel and you'll get notified the next time Kevin's on. He's reading chapter 3, and you can take a passive approach. Also, you could just type in comments, because we have our amazing producer, Joshua, who's there gathering those comments and questions and bringing them to Kevin to answer. But thanks everyone for joining us, and I hope you have a wonderful.
This little book I created, is dedicated to Kim. And I want to read it out. Thank you so much for all you do for us, especially your work to help patients avoid unnecessary amputations. Thank you.
Kevin. You're amazing. Thank you.